and I'm here to take your physical assessment. Is that okay with you?
Yes.
So, what's your name?
Mayan.
May I have your hand? What's your name?
Mayan.
How old are you?
25.
Oh, when were you born? When were you born?
96.
Okay, great. So I'm going to check your physical assessment as I already said. But first, can I go perform hand hygiene and then also gather my instruments and then come back. I'm going to start with a few questions. Is that okay with you? Which country do you think you're in? Which country are you in right now? Your country, the country you're in right now.
In United.
Where?
In UAE.
Okay, which hospital are you in?
Mama's hospital.
No, I mean the
No,
country.
okay.
Which hospital are you in right now?
Yes,
And what am I here to do?
Okay, you're here for assessment.
Okay.
Okay.
Now, ma'am, can I take your vital signs? Is that okay? Okay, before we begin everything, may I have your arm right here? May you place it right here? Be comfortable. Is it okay if I start with taking your temperature, your oxygen saturation, and your blood pressure all at once? Is that okay? Okay. Have it cleaned. It's okay. Right here. Okay. Okay, and your blood pressure. Let me just put this in this hand. Okay. Just place it here. Okay, stethoscope.
There.
Hmm?
There.
Just feel. Just hold it there. And I'm going to palpate your. Just leave it down. Palpate for your brachial artery. Right there. So. Gently. Just place it on the hand for me, please. Can you help me hold this a little bit? Do you mind? Thank you. Okay. Okay. All right. Can I have the stethoscope?
Yes, I do. I'm saying
Okay. Working. Okay. This is 35, 36 rather. Okay, great. Now we're going to start. We're going to start with your face. Can I look at your face? It's the same skin tone as the rest of your body. I'm going to don gloves. I'm going to perform hand hygiene, don gloves, and then look at your hair. So I'm going to, is that okay if I put this down? Okay, great. So I'm inspecting your hair before I palpate it, and it looks good. Let me feel for lumps. Is that okay? Okay, the skin texture is good. The color of your hair is good. I don't feel any lumps. No infestations like lice, or I don't see any baldness. Maybe a little dandruff here and there. Here. Now I'm going to document my findings, and let's put this back on you. Next, I'm going to go to your eyes. I can see your eyes are symmetrical to your face, and they should be across to your ears as well. I can see your eyes are round. They're a bit yellowish, but the pupils are perfectly round as well. May I palpate your eyes, please? Great, that is a lovely color, pink. May you look up for me, please?
Let me see if you have any.
Yeah, no, don't, just look at me and just, yeah. Okay, great. Pink as well. Now I'm going to focus with my pen light. Now I'm going to dim the lights a little bit so that I can see how your pupils dilate and how they constrict. Is that okay? Okay. Please look here. Here. Can you look on your left and on your right? And can you look for me up and down? And down? Thank you. So I'm going to put my phone this far, my pen light this far. Can you please follow the light until it reaches your face? Can you do that for me, please? It's okay. Just follow the light, right? Great. Thank you. So, in brief, when I see ERRLA, which is her pupils are equal when you look at them. Her eyes they're round, the pupils are round, or her eyes are round, perfectly round. They are reactive to light and they accommodate. Accommodate means when I put my pen light away from her, she still can see from far to close where the pen light reaches her face. And next, we are going to look at her ears. Is it okay if I inspect your ears, Mom? Okay. So we're starting with the right ear. So I'm looking at it, and does your ear hurt inside in any way? Do you have pain in your ear? Okay. So I'm not going to don gloves. I'm just going to sanitize my hands. And now I'm going to palpate and just try to see if there are any rashes, any abnormalities, any lumps, any fluid at all coming from the ear. And then you also have to check, there's a bone behind your ear as well. So you have to check, sometimes it's swollen or it's abnormal, so you check for that as well. And her ear looks good. I'm going to check the other one. Doesn't have to, it looks normal. Doesn't have any lumps or anything. So I'm going to focus using an audioscope. So the audioscope is basically meant to see inside the ear. I'm inspecting her nose. Mom, do you have any sinuses? Do you have flu? You have sinuses? Do you have any pain in your nose? Okay. So now I'm inspecting it. And now I'm going to hand wash because there's no fluids. She has no flu. And just palpate with my hands. I don't need gloves. So then I'm palpating, trying to see if there are any wounds inside or anything swollen. Yeah, there's nothing. So I'm still going to get my pen light. Getting my pen light and trying to see what's inside, looking for any wounds, any abnormalities in the nose, any scarring. Everything looks good. So I'm going to, what's it called? Breathe in and out. Mom, can you do that, please? Breathe in and out. Do you have any difficulty doing that? Okay, great. Let's do this as well. Breathe in and out. Breathe in and out. And what I forgot also about the ears, I need to check whether her hearing, if it's good or if it's terrible. So how you do that is I'm going to hold her ear and then try to whisper something and see if she can hear me. Did you hear that? What did I say?
Not exactly what I hear you.
Chocolate.
Yes, chocolate.
Okay. Can you hear me?
Yeah.
What did I say? Okay, great. So her hearing is good. Her nose is doing what it should be doing. So let's move on to her mouth. Her mouth, I'm inspecting for lesions, cuts, any kind of bruising, and also looking at the lip color. She's got hyperpigmentation, just a little bit, and that is a little darkness around her lips. And Mom, do you have any pain, anything? So just to be safe, because I don't know what's in her mouth, I'm going to perform hand hygiene and don gloves. And Mom, can you open for me your mouth, please? So I'm inspecting what's in her mouth before I palpate. And now I'm going to get my tongue depressor to just, I'm not going to insert this, don't worry. And your sides, yeah, you have a few wounds. You have a few wounds. Let me see if you have cavities. She barely has cavities. Well done. Now, can I look at your uvula? The end of your throat, that tiny thing? Good, good. It's perfect. Thank you. So I'm going to document what I just found.
Okay.
And now we're moving on to the neck. Yeah, to the neck. Can you move your head a little to the 45 degrees angle, please? Thank you. So now I'm looking, inspecting, and it doesn't look lumpy. It doesn't look like there's lesions. So I'm palpating it. Doff gloves, hand hygiene. Now I'm palpating it with my hands. And her trachea looks good. I don't feel any lumps. No thyroid. Now I'm going to feel her carotid artery. Good. Good, that's a 2+. 2+ means it's a normal pulse. Okay. Now, if we're in hospital, I'm going to ask her to remove. So when this is your clavicle, so you go down your clavicle, and then about here on your right, that's where you find the aortic valve. On your left, just a little opposite, is where you find your pulmonic, and below is where you find your Ebbs point, and then below that, where you find your tricuspid, and then just around down here is where you find your mitral apex or valve. So now I'm listening. Usually also, I don't know how true this is, usually when you're listening to these sounds, the aortic and the pulmonic, which are the top ones, is usually the sound that usually you hear the most is sound S2, right? It's S2 usually. And when you go down, which is the tricuspid and the mitral apex, it's usually S1 sound that you hear first. So let's take a listen. Can't hear anything. Can't hear much because of all the
Of the
clothing.
yeah.
Yeah, but that's it has, you have the same color, the skin tone as the rest of your body. Let me pinch your skin and see it's perfect. Can I palpate your radial artery? It's a 2+, meaning it's a normal rhythm, a normal beat. Your brachial artery, which is a 2+ as well. And now I'm going to check for capillary refill. Capillary refill is you press the extremities on the fingers of the toes, and you find that blood is going to disappear for a bit. So we're checking for how fast the blood comes back on all the fingers. This is capillary refill, and it's good. So I'm also looking at her fingers. Are the joints normal? Are her fingers normal? Yes, the joints are normal. Mom, can you twist your arm for me? Good. Squeeze my hand. We're checking for strength and range of motion. Can you do this for me and this? Good. The same. So you repeat the same on this arm. And you're checking for the skin. You're checking for the pulse. Great. You're checking for the pulse. Excuse me, it's a 2+. You're checking for capillary refill again. And it's good. So you're still also looking at the joints, and they're good. And now, Mom, I need you to hold out your hands. So now we're looking for if they're stable, if they're going to fall, that means she can't hold her hands up straight for a while, or if they're unbalanced. So we're looking for that. And they're good. Thank you, Mom. You can put them down. Now, at this point, we're going to the middle area. I would naturally, I'm checking for colors, you're checking for craft feet, ingrown toenails, and all things like that. Thank you.
Thank you for watching, and don't forget to subscribe and hit the notification bell so that you will be notified every time I have uploaded a new video. Thank you very much, and God bless.